Hi, this is a scribe training video to explain how to do a few types of diagnoses. I'm going to start with routine care note within a test patient. Then you're going to go down to the procedure codes. With this, I have some groups already set up. So one's called like a nail care. I'm sorry, this is procedures. So within procedures, the most common procedures we do are for keratomas. So keratomas are either 1, 2 to 4, or 5 to plus. Keratoma is the same thing as a callus. So I would do that one. And then as I mentioned before, on the right side, and I copied and pasted, I'm going to put in which ones we did. So if it was the right, first, and fifth med head, the same thing from the physical exam I put in here. That's under the calluses as well for nails. It's going to be a debridement of nails. So it's usually 1 to 5 if there's less than 5 nails, and then 6 to 10 if there's more than 6 nails. So the one that I put in there, it was the right, first, and fifth. Those were the ones I derided. And then the other ones I usually put in there under trimming of toenails. So you have to pick the other ones that are there. So all the other ones you would pick through as being trimmed. So that's how you would do nail debridement and then trimming depending on what it is. Now, if there's 6 to 5 or 6 to 10, you wouldn't have to put in any of this. So those are the more common things that I use. Sometimes with routine care, I'm going to do a porokeratoma, which is a really deep one. I'm not doing this every 3 months. That's just not the way to do it. It's going to be, but if it's like once a year or every so often, I use a lesion destruction code, which is this one right here. This is the same thing that I'll use occasionally for a wart, but it's a lesion destruction code on a very deep callus that's deep inside called a porokeratoma. So that would be the diagnosis that I would use. Those are the most common diagnoses that we're going to use in a routine care note. Occasionally, if they have an ulcer, we'll use like an ulcer debridement as well. Like if it's a debridement of an ulcer, there's going to be a skin tissue debridement code that could be used as well for that patient. So those are the procedure codes, and then the procedure codes they need to match with the assessment and plan. So assessment and plan, what we have here is I think it's under nail care. It's under routine. So when you hit routine, it's going to actually pull in foot callus, ingrown toenail, foot pain, and then onychomycosis. Then also you're going to pull in if they have diabetes. You could pull in a diabetes type of a template. There is a diabetic with a diabetic shoe referral as well, but for diabetes, you're going to pick type 2 diabetes for the most part, and then you can pick by clicking this